My name is Ewaoche, and today I'll be talking about responses to cytokines and a healthy pregnancy. So I'll be walking you through this table of contents. As you can see, we'll be talking about pregnancy, we'll talk about cytokines, the role of cytokines in the first, the second and the third phases of pregnancy, drawing our conclusions and then letting you know about our references. So what is a healthy pregnancy? A pregnancy is said to be healthy when it lasts the full 9 months. A pregnancy is said to be healthy when it results in a healthy baby or babies weighing at least 5.5 pounds, which is equal to about 2 kg, and the baby has no defect. Now, pregnancy generally is divided into trimesters. We have the first, the second, and the third trimesters. The first trimester is from first month to third month, the second trimester from fourth month to about sixth month, and then the third trimester from about 7 months to 9 months. And across these trimesters, there are different developmental changes, which you shall get to see very soon. Now, let's talk about cytokines. Cytokines essentially low molecular proteins that communicate across cells. Yes, cytokines communicate across cells, while hormones communicate across organs. So there are different cells can produce cytokines. Virtually all the cells in the body can produce cytokines, one or a specific type of cytokines. Now, there are mechanisms of action by which these cytokines work. One is the autocrine, the second is the paracrine, the third is the endocrine. So the autocrine is when the cytokines communicate within the cell. The paracrine is when the cytokine communicates across neighboring cells. And when the cytokine communicates across distant cells, we say it is endocrine. So these are the mechanisms by which cytokines work. Now we have different types of cytokines. There could be colony stimulating factors, the interferons, the interleukins, the tumor necrosis factor, the transforming growth factor. Take, for example, the interferon is the missing link between the innate and adaptive immune system. Upregulations of interferon leads to thousands of genes that are antiviral, anti-inflammatory, and immunomodulatory. Example can be seen in interferon alpha, interferon beta, and interferon gamma. But generally, cytokines can be divided into pro-inflammatory cytokines and anti-inflammatory cytokines. The pro-inflammatory cytokines supports inflammation, while the anti-inflammatory cytokines go against inflammation. Now, cytokine activity in a healthy pregnancy. The first trimester, it is pertinent to mention that it is dominated by pro-inflammatory cytokines. The second trimester is dominated by anti-inflammatory cytokines, and the third trimester is dominated by the pro-inflammatory cytokines, in addition to other cytokines that facilitate the parturition. Now let's go into detail. The first phase of the pregnancy is characterized by what? Implantation. Now, upon fertilization, the blastocyst invades the uterine epithelial lining. The blastocyst would damage the endothelial cells lining the endometrium. Remember that the uterus is divided into three: the endometrium, the myometrium, and then the subserosa. The endometrium, which is the inner lining, is lined with what? The endothelial cells. Now the damaged tissue, the damaged endothelial cells are replaced by the blastocyst trophoblasts to ensure continuous blood flow. Now there will be infiltrations of invading cells, dying cells, and repairing cells. Now, to remove these infiltrates, an inflammatory response is required. This response is coordinated by cytokines, notably the interleukin-2, the interleukin-4. We talk about the regulated on activation, normal T cell expressed and secreted, the RANTES, and so many other cytokines, as you can see. Now, we talk about the second phase of the pregnancy, which has to do with the adaptation. The semi-allogenic fetus has to be adapted to the uterine lining, and this is what happened. There is a switch from the pro-inflammatory Th1 cytokines to anti-inflammatory Th2 cytokines via the natural killer and lymphokines activated cells. At the fetal maternal interface, modulatory cytokines such as the interleukin-3, interleukin-4, 5, and 10 are present. What they do is to reduce the Th1 type responses. We have the growing gestational sac. The growing gestational sac too may cause a mechanical stretch in the uterine wall, resulting in the production of transforming growth factor, which may speed up uterine growth. There is also an endometrium, which produces interleukin-1 alpha, beta, interleukin-6, and interleukin-8 during this expanding phase to maintain an anti-inflammatory state and promote uterine and fetal tissue development. So the third phase is what we call the parturition, that is the labor. You know, what happened here is that there is an upregulation of inflammatory cytokines, such as the interleukin-1, interleukin-8 in maternal fetal tissues, and transcriptional changes in the decidua, including the upregulations of the TNF signaling pathway, the NOD-like receptors, and NFB activation. There is an invasion and relocations of myometrial leukocyte. Also contribute to the productions of inflammatory and chemotatic cytokines, such as the interleukin-1 beta, 6 and 8, generations of prostaglandins, oxytocin, intracellular calcium, phospholipase, etc., required for uterine contraction during parturition. Now, the cervix epithelium produces a variety of cytokines. We talk about the RANTES, which we saw in the implantation phase. We talk about the TGF. We talk about the interleukin-1 alpha and beta, interleukin-6, and a whole lot of them. Now, how do we measure cytokines in the laboratory? The measurement of cytokine in the laboratory is by the enzyme-linked immunosorbent assay, which is called the ELISA. Now, in conclusion, there is an interplay of both pro-inflammatory and anti-inflammatory cytokines in maintaining a healthy pregnancy. These cytokines can be modulated by proper nutrition, though not in the text. So you have seen that the first phase of the pregnancy is characterized by pro-inflammatory cytokines, the second phase anti-inflammatory cytokines, and then the third phase we have what? The pro-inflammatory cytokines. However, there is an interplay of these cytokines. Some that acted as pro-inflammatory in the first phase equally acted as anti-inflammatory in the second phase. So like interleukin-6 basically acted as what? Pro-inflammatory cytokines and anti-inflammatory cytokines. Interleukin-4, pro-inflammatory cytokines and anti-inflammatory cytokines. So these are the responses of cytokines in a healthy pregnancy. Please these are my references, and thank you for listening. But please do subscribe to my channel. Thank you.